Good afternoon, class. We are Group 3 and we'll be discussing the topic of health disparities and inequalities in our presentation. Health disparities are health differences that are associated with economic, social, and environmental disadvantages. Health disparities affect groups of people based on factors such as racial background, gender, socioeconomic status, sexual orientation, and geographic location. Those affected are unable to have no or limited access to high quality and affordable health care, nutritious food, and health insurance. Health disparities disproportionately affect racial minorities, LGBTQ members, and people who are of low socioeconomic status. Health inequalities are differences in the distribution of health resources and health status among different groups of people. Some causes of this includes income gaps, racial discrimination, lack of access to quality health care and education, as well as inadequate housing and unsafe and unclean environments. Health inequalities also disproportionately affect racial minorities and people living in a low-income household and members of the LGBTQ community.
So, what is the significance of health disparities? So, the population is becoming more diverse, so it's important to address these disparities since they tend to affect people of color. It is projected that the minorities will actually become the majorities by 2050. The victims of health disparities are also less likely to receive quality care, which could shorten their lifespan. On the website Advancing Health Equity, it mentions that minority patients tend to receive lower quality care compared to white patients. Lastly, we want to improve the health of the overall population. That should always be the main priority. We should always want to provide quality care and equitable care. And equitable care just means to provide equal care to each patient regardless of their race, gender, income, or sexuality. So, existing health disparities and inequities in the US. So, some racial and ethnic disparities and inequities is that minority groups have higher rates of chronic disease and premature death compared to the rates among white people. The African Americans also suffer disproportionately from HIV and AIDS. The African American white disparity in AIDS and HIV diagnosis has actually grown substantially over time. So if we look at this graph from the CDC of new diagnosis of HIV infections in 2018, we can see that Black and African American males have a higher morbidity rate compared to all the other racial groups. Mexican Americans also suffer disproportionately from diabetes. According to the CDC, if you're a Hispanic or a Latino, your chance of developing diabetes is more than 50% compared to the average U.S. adult whose probability of developing diabetes is 40%. Native Americans and Alaska Natives also have a high infant mortality rate, so this rate is 60% higher than the rate of white people. So some gender disparities is that women are more likely to be diagnosed with anxiety or depression, and they're also more likely to suffer injuries from an assault. Their health is greatly affected after experiencing violence, which could lead to an increased risk of arthritis, asthma, and heart disease. As for men, they are more likely to have a substance abuse and more likely to commit suicide. And for the gender pay gap, although one may think that this might not count as a health disparity, income is closely tied to health. Therefore, the gender pay gap could result in women not being able to afford quality care due to this gap. LGBTQ disparities. So this group is really affected by HIV and AIDS. If we look at this graph, we can see that gay and bisexual men aged 13 to 24 made up the most of new HIV diagnoses. They're also more likely to commit suicide and be bullied, and transgender women of color experience the most high levels of violence compared to any other group. As for individuals with disabilities, they experience higher rates of chronic disease. are 4 times more likely to report having fair or poor health and also have higher rates of obesity. My last group is veterans. They have a higher rate of suicide risk, homelessness, and mental health issues. So this graph is from the U.S. Department of Veterans Affairs. So you can see like these two lines are the veterans, and they have a higher rates compared to the general population. Sexual trauma is also more common in this group.
Hi, my name is Atumulara Kingba. I'm going to discuss the existing health disparities in California, and the second topic I'm going to discuss is the initiatives to alleviate existing health disparities. First, I would like to acknowledge that California is the most racially diverse state in the United States. Therefore, in terms of health disparities, that is something to look out for. Out of all racial groups in California, Black and Latinos are more likely to suffer in terms of health disparities. A few examples are that Latinos have a higher risk of receiving wages below the federal poverty level, which can force them to not be able to afford adequate health care. The second thing I would like to discuss is that compared to the state's average, people of color, including Black, Latino, Native American, and multiracial, including members of the LGBTQ community, have a higher risk of mental illness. I would also like to state that Native American individuals in California have a suicide rate much higher compared to the state's average. And finally, Black people in California have a much shorter life expectancy compared to the life expectancy of all races and ethnicities in California. When compared to the life expectancy to Asians, there is an 11.2-year difference. Now I would like to discuss the initiatives being taken to alleviate these disparities. One initiative that is being conducted is that more healthcare providers are now being trained to provide culturally responsive care to patients. This is beneficial because this can help improve the health and the outcome to reduce health disparities in marginalized communities. There is also a local initiative based in Long Beach to help reduce disparities within the Black community. It's called the Racial Equity and Reconciliation Initiative. Their leading objective is to raise awareness and terminate existing health disparities and inequities that Black people face in today's society.
As we understand, health disparities has been around for the last century, and during COVID, it has continued to cause struggle with those of different ethnic backgrounds. People of color are at a higher risk for contracting COVID due to underlying health conditions that these patients already had compared to whites. Research continues to show that racial and ethnic minorities are disproportionately affected by the COVID-19 disease. Ethnic minorities tend to live in a crowded public housing condition, which makes it harder for social distancing. People of color tend to have employment that is largely with interactions with the public, such as the service industry, which allows for more exposure to the virus. Another problem we face is access to healthcare and how that will affect minorities in seeking proper treatment and prevention. According to the CDC, only about 6% of non-Hispanic white people were uninsured, while 18% for Hispanics and 10% of Black people did not have health insurance. Given what we know about the current underlying problems that Blacks and Latinos face, the COVID-19 pandemic will place the minorities at even higher vulnerability. Education, income, and wealth gaps are also factors that contribute to the health gap. People with limited job opportunities tend to receive lower pay wage and therefore lead to unstable jobs. This cycle therefore causes people in these situations not being able to afford to miss work, even when they're sick, because they need the income to pay for the mortgage and other obligations and basic needs. Efforts that are currently being done to close the gap during the COVID-19 pandemic includes the economic stimulus check that has eased the financial struggle for a lot of American families. Telemedicine visits are being used more frequently in the last 10 months to help those with a weak immune system to not be exposed to the virus. Many insurance companies are waiving the telemedicine fee during this time. The CDC has made an effort to translate vital information regarding the COVID-19 epidemic in many different languages in a timely manner, as new information about the virus is constantly being updated. Many public areas are making sure posters and messages such as social distancing, self-quarantining, washing hands, and wearing a face mask is understandable across all cultures. There are currently a lot of organizations, healthcare systems, public health agencies, and policymakers helping to promote fair access to health. In order to fight the epidemic, our country must stand together as a community to make sure that all communities are getting the necessary health care needed.
Hey class, my name is Dhruv, and I'll be discussing some potential solutions to the issue of health disparities that exist within our society today. The first macro level potential solution is something you may have heard of, and that is universal health care. We see this in a lot of countries around the world, but for some reason America has not adopted this yet. By providing a system of universal health care, we could give coverage to everyone, and that would create for a far more equitable, integrated, and effective system. The current model of tying healthcare to employment is unfair. Some people aren't employed. Some people get stuck in jobs they don't want to be in because they have to keep their health insurance, and that isn't fair. Another solution is something called universal basic income. You may have heard of this if you follow politics and have heard Andrew Yang speak. But essentially, this would allow for all Americans to be able to afford essentials, such as paying their rent or affording groceries for the month. And that could significantly reduce health disparities. And lastly, we could see a form of universal basic income being applied now. We need stimulus checks in society during this COVID pandemic, because that will help everyone be more financially and more health-wise well off. So to close today, health disparities remain a large issue in society. The gap in wages continue to widen, and even more so during the COVID-19 pandemic. Minority groups continue to have inadequate access to healthcare, housing, education, transportation, and clean water. The first step to attacking this issue is to acknowledge its existence. It's vital for policymakers to create new legislation that helps ease these burdens for underprivileged groups. We can all make a positive difference to this situation by continuing to vote and express our opinions, to vote for progressive policymakers that advocate for people that are being left behind, who are disproportionately affected. Additionally, there is a local initiative called the Racial Equity and Reconciliation Initiative that's occurring here in Long Beach, and I encourage all of you to take the time to go to longbeach.gov and type in the Racial Equity Initiative and take a look. It's a great resource, and it can really explain what's going on in society as far as health disparities, particularly in the Black community. So I just wanted to say thank you to all of you for listening to our presentation, and I hope you learned something about health disparities today. Thank you.